Yes, so I'm a podiatrist with the NHS, currently based in the Western Isles. I've been a podiatrist for about 10 years, working throughout the UK, and I'm obviously Australian. So important that people know podiatrists are not nail cutters. That's not the primary role of our job. The job is a lot more complex and there's a lot more to it than that. So we're primarily involved in management of the foot and lower limb, so particularly for people with things like diabetes, heart conditions, circulation problems. We're involved in wound care or ulcer management, and injury to the feet, and prevention of things like amputations. We're also involved in injury and pain management, so things like ankle sprains, knee injuries, those sorts of things. And we use things like orthotics or supportive insoles to help manage conditions long term, prevent recurrence, those sorts of things. And so podiatrists can work in both the NHS or private practice, so they're quite distinct fields. So like lots of people, drawn to the profession with the idea of helping people overcoming problems and injuries. It's a surprisingly interesting and diverse job, and it's enabled me to travel throughout the world, living and working in different places, which is, I think, really important these days. It's allowed a good work-life balance too. I think it's important as well that you can have interests and things outside of the job, and we're quite well paid, so that's nice. For a new graduate in the NHS, it's £25,000 per year. So it's a 4-year university degree, and prior to that you would need certain courses as part of your hires, so English and maths, for example. So an interest in others and helping other people, and also an interest in other medical fields as well. Probably the variety of work possible. We work in different fields, as I mentioned, within diabetes and wound care, injury and pain management, and also nail surgery. So no 2 days are ever the same, which I think is a nice thing in a job. It can be challenging. I think that podiatry can be misunderstood. Lots of people don't necessarily realise that it's an interesting and complex profession. There's lots of, as I mentioned, lots of different areas that you can work in. It's also difficult sometimes managing patients with complex medical conditions, and sometimes it's not necessarily possible to fix everything, and that can be challenging to manage. Definitely. It's given me a lot of flexibility and freedom in life to be able to live and work all over the world, as I mentioned. And I think that's kept the job interesting for me. So I think that's a really helpful thing these days.